coming up on Week in Review.
This is now a stay-at-home order.
Please stay home. Today, despite our differences, we stand and speak united as one.
This is serious, and it's only with the total cooperation of our community can we be successful.
So are Kansas Cityans listening? Are we really staying home? And if not, what happens next? On this Newsmaker edition of Week in Review, Mayor Quinton Lucas joins us. Plus, with a 300% increase in calls to the suicide hotline, we check in with a local mental health expert. And as one of the biggest disruptions to our daily lives has been felt at the grocery store, we pull back the curtain on the grocery business with leaders from one of the Metro's largest grocery store chains. We talk toilet paper to safety.
Week in Review is made possible through the generous support of Dave and Jamie Cummings, Bob and Marlise Gorley, Smithfield Foods, Haas and Wilkerson Insurance, the Courtney S. Turner Charitable Trust, John H. Mize and Bank of America N.A. co-trustees, and by viewers like you. Thank you.
Welcome everyone, I'm Nick Haynes. We are wrapping up an unusual week in Kansas City, and we here at KCPT are as disrupted as you are, all of our staff working from home, a skeleton crew coming in so we can still be with you this half hour, and we're slimming down the number of guests around this table to adhere to important health protocols. But we're keeping calm and carrying on, and so is Mayor Quinton Lucas. We're now the better part of a week through an emergency order all across the Metro to stay at home. Are we behaving ourselves? Are we doing what you expected, or are we falling short of what you and public health officials expected?
By and large, I think Kansas Cityans are behaving. When you look at people who are staying home from work, not going to non-essential businesses, we've had largely great compliance. We've had some issues with playgrounds at our parks, and we've tried to message to people, you can't be on the playground, you can be out walking, but keep social distancing. But by and large, I think our community throughout the Metro has taken heed of our warnings.
As you mentioned, the city closed all the playgrounds, the tennis courts, put up signs telling people these are off limits, and yet still plenty of kids on those swings this week, plenty of adults still on those tennis courts. Does that mean there has to be a ratcheting up of enforcement no longer? Is it just something you say, hey, please get off that you need more enforcement action?
You know, I actually think no, not yet. I mean, we continue at City Hall to take calls. Usually we have our Regulated Industries Department or the Health Department that's doing a lot of our enforcement work. We don't want to go around like Big Brother. We don't think the police need to come and break up park groups, that sort of thing. We really just encourage people right now to follow common sense. Now, of course, if we keep seeing some of the concerns and issues we've had, then we may need to ratchet it up. But at this point, city government, the police department, no one is interested in doing that.
Has any of those inspectors with the Public Health Department or Regulated Industries, yes, or have you had to impose any fines on anyone?
So, you know, we have not had to impose fines yet. Usually people do actually listen to a call. We have had to call several businesses and say, whatever type of business you're in, you can't keep your massage parlor going or some other types of organizations. And so that's the work we've done, and largely people have complied because I think everyone in our community gets it right now. This is to keep us all safe.
This is all about keeping just essential businesses in action, but is there still a dispute over what makes an essential business? We saw Nebraska Furniture Mart still open its doors for most of the week, saying they were an essential business. They then have since closed. But now there's a dispute over Bass Pro on both sides of state line. Gun stores here on both sides of state line open, yet in many states that is not considered an essential business. Are those questions still coming up?
You know, I think they'll continue to percolate for as long as we're in this crisis, but I've usually followed this rule of thumb, which is that if you have to ask whether your business is essential or not, it's probably not. And it's important for people to realize essential doesn't mean valuable. Everybody's livelihood, everything is very valuable, but essential is what do we need to keep this city moving? What do we need to keep people healthy and safe? And largely, I think over the last several days, we've had people figure that out, and I expect to have even less controversy as time goes on.
Now, this stay-at-home order currently would go into effect until April 24th. What happens, though, if you're not seeing a reduction in the number of infection cases in this community? How do you know you're being successful?
Well, I continue to talk to our Director of Public Health every day. We look to and talk to experts throughout Missouri and Kansas, and frankly from throughout the country. And I think what we will continue to do is to see how effective are we being, how are we working with other jurisdictions throughout our region and beyond to see if this is the right approach. And then certainly before April the 24th, we'll evaluate the efficacy of our order. A few things that I think can help us read how we're doing. What's the drain on hospital rooms? How are we doing with our emergency services? How are we doing in total infection rate? We hope to flatten the curve, and we would like to see at least a slower increase here in the Kansas City area as our
If you're
sign.
not flattening the curve, what would the next step be?
You know, at this point, we have a number of different options. You've seen some cities go to a more intense quarantine type of approach. That's what you're seeing in Europe right now. That's what you're seeing in the United Kingdom. I certainly don't think we need to be there yet. And actually in New York City, in that metro area, you're getting more of that. I think we would probably look at phases, but some perhaps closing down more businesses. We will see more opportunities to allow for greater social distancing. But at this point, I don't want us to get there. If everybody follows the rules at issue, I think we'll be in a good place.
The city passing a budget this week, and some concerned that, wow, why didn't you scale back more of the non-essential things from that budget, particularly as more and more people are going to be unemployed. Your taxes are going to go down from coming in from the earnings tax, from the sales tax, from the hotel tax. Shouldn't you have been a little leaner in that budget than actually increasing it as you did this week?
I think we're always lean in the budget, but what we recognize were a few things. First, we have passed relief funds for small businesses. We have pushed back the earnings tax deadline from April 15th to July 15th. Those are things that we recognized where the pain was, and we wanted to address it. In terms of reducing the budget even further, my view is this. We will, at the end of every quarter, have a chance to review where we are, where our performance is. It is not impossible for the city to scale back some of the investments it's making. One of the key steps we made was a hiring freeze that we instituted. I believe we're the first in the metro to do such a thing, where we will not be hiring new employees unless they are absolutely essential. We won't do more consulting contracts. We're looking to already cut out in excess of $10 million a year or more in some of the expenses we have based on cutting consulting contracts, professional services, et cetera, which will help us get through this moment.
What about the tens of thousands of your constituents now who will find themselves without a job, unable potentially to pay their rent, to be able to put food on the table? Is there anything in it for them?
You know, my heart breaks for everybody who has been impacted economically by our current situation. We have a few different models and plans. My office has worked with a number of nonprofits and foundations in our city. You probably heard earlier this week announcement of a $10 million fund that more of the private sector is helping to raise to help support a social safety network. When I mentioned small businesses before, that's really more of the mom and pop shops, those barber shops, those other businesses that are shut down entirely right now and don't have a huge supply chain to help support them. So that's some of the work we're doing. But, you know, our work doesn't necessarily just stop with the budget. It also continues to how we support homeless shelters, how we support medical services, how we support renters, how we support zero fare transit. That's the work that we will continue to do in Kansas City. And I think all of that social safety network that we fund each year will go to address many of the challenges that we're seeing right now.
We in the media certainly do like to look at some of the ugly things that are happening right now, including when somebody rips the dispensers of hand sanitizers from the restrooms at KCI Airport. But there are uplifting things happening in this community right now. What has been the most uplifting story that you've encountered over the past week, Mayor Lucas?
You know, I actually bumped into a homeless gentleman the other day who was talking about the current situation and was talking about how kind the staff has been. Our homeless shelters are on the front lines of dealing with this crisis, of perhaps screening people who might be exposed, but continue to show up every day without many resources. The work that they are doing to treat people with care, with kindness, is something that is an amazing example for this community. And right now, what I think about in this moment are the grocery workers, the folks in homeless shelters, the nurses, the hospital staff, the people that are largely unsung in this crisis, but are key to making us get through it.
And we'll be hearing from those grocery store owners in just a moment. But what about those people who cut our hair? Where are you and I going to go to get our hair cut as a result of this?
Well, you know, I think they will see just how bald we may be as some of it grows out on the sides over time. You know, for those who watched the Jeffersons years ago, George Jefferson had this large afro only on the sides. I may model such an outfit.
I saw one tweet that said, when you did your news conference this week, that if Mayor Lucas is wearing a polo shirt, run, don't walk to the basement because something terrible is about to happen. It's great to see that you're still wearing a suit, so we're still in good shape.
I feel like I'll keep this suit on as long as possible, but if I go to the polo shirts, then yes, it's a wild time.
Okay, we'll watch for that. Mayor Quinton Lucas, thank you for spending the time with us on Week in Review. Did you see this week, by the way, that calls to the National Suicide Prevention Hotline have risen 300%? While we're so fixated on what this virus is doing to the physical health of us and the health of the economy, what about our mental health? We check on that next with a local mental health expert. This is Kansas City Week in Review. And joining us now is Kansas City psychologist and author, Dr. Linda Moore. Dr. Moore, when dentists are now no longer seeing patients and we see many regular health checkups being postponed, are you still seeing patients?
On the phone.
On the phone. Does that compromise the therapy that is being provided?
I think it changes it dramatically because I miss the body language. I miss the shifts in facial expressions, all of which give me a lot of information about what people are saying.
We see reports and we see that, there's a 300% increase in the suicide hotline. Are you seeing an increase in the number of calls coming to you, or is it still about the same?
It's about the same, and part of it is most interesting. What I've discovered is my clients don't have the privacy at home to talk on the phone that they would like to have, because they have all their children there, their spouses, everybody's working, and it's sort of chaotic. So some people are taking their time.
Have the concerns changed, or are they the same as they were before?
I think amplified. In other words, things that we already had difficulty dealing with were now like in the system, and if we went away to work and school and avoided talking about them, now we're together all the time, and so they get amplified.
We're also hearing about not just on suicide, but we could see a massive increase in the number of divorces. We can see a lot more domestic abuse cases taking place. Are those scenarios and headlines overblown?
I haven't seen it yet, so that could be coming, but I'm not seeing it right now. I'm just seeing people struggling with talking to one another when, in fact, they have not been talking to one another anyway, and now they're all together. And so people are a little scared, a little uncertain about how to handle things. And one of the biggest issues in our culture, 75% of us are extroverts, 25% of us are introverts. And so when those people live together, it makes it very complicated. And the reason that's important, extroverts rebuild energy by interacting, by being out and about in cultural events. Introverts replenish energy by being quiet, peaceful. So if you have people living together who have those different needs, it can be really hard.
So what is the big advice that you're offering over the phone right now to calm down your patients and, in fact, the people watching this program right now, Dr. Moore?
Well, one of the things I suggest is please establish a routine. Please get a routine together for everybody in the family that works. Create quiet time, alone time, and have family meetings. Even the littlest kids will contribute to a family meeting where you discuss, how are we doing? And what's not working? And what is working? Because our thoughts make us get more and more stressed. For example, if I say, this is difficult, this is hard, this is challenging, I'm okay. But if I add to that, and I can't stand it, then I'm doing something called thought distortion, and I can react to the distorted thought rather than the reality. So we come back to, I don't have to like it, but it's here and I have to deal with it.
What's the one thing I can do right this moment as I'm watching this program to reduce my anxiety level at this moment in time, Dr. Moore?
Well, one is constantly breathe, constantly take deep breaths. Learn to meditate if you can. There are all kinds of apps for doing that. Learn to meditate and move. Get some movement, particularly if you have small children. Get everybody moving. Psychologist
and author Dr. Linda Moore, thank you so much for being with us, keeping us on an even keel during this half hour on Week in Review. One of the biggest disruptions to our daily lives has been felt at the grocery store, where it's almost impossible to find basics like toilet paper, even eggs and flour. Next up, pulling back the curtain on the grocery business. Stay with us on this Newsmaker edition of Kansas City Week in Review.
Everything you see on the shelf is what we have. We're getting more stuff throughout the day. No toilet paper.
Isn't it amazing that something as simple as toilet paper is almost impossible to find? And is it not the only frustration many Kansas Cityans are experiencing as the public health emergency continues? With us are leaders from one of the Metro's largest grocery store chains. John Cosentino is in charge of operations at Cosentino's Foods, which runs 30 grocery stores on both sides of State Line, mainly flying the Price Chopper flag. Aaron Greer has responsibility for all of those workers as Cosentino's Director of HR. Thank you so much for finding the time to be with us. But John, let's start, if we can, about what about that toilet paper? Is that an old story, yesterday's news, or is hand sanitizer and toilet paper still a scarce thing to find in your stores?
Well, I'll tell you, it's been a crazy 10 days. You know, I think everybody was kind of out there panicking a little bit. But I'll tell you, the last 4 or 5 days, everything's slowed down. Our stores are replenishing fast, and I think that's building some confidence with our customers. But I will tell you, yeah, toilet paper is one of those items that has been really hard to get.
As a customer of yours, though, I have to say I was also surprised. You can never find flour. It's almost impossible to find eggs. Why those products as well?
Well, I think it's just a supply and demand more than anything. I don't think there's a shortage. I think that it's really that everything just hit within 10 days, and I think you'll start seeing that if over time things will come back in. Eggs, you know, it's getting a double hit right now with Easter coming up. So I am concerned about that one. But the good thing is I saw eggs in our store yesterday, so I can see that supply chain getting a little better.
Between the three of us and our cameraman over there, when's the best time for us to come to your store if we want to find some of those scarce essentials?
Well, I think, first of all, you know, we're asking our customers to honor the 7 to 8 for those more in need and then for our seniors. And so we want to continue to do that. But I think everybody knows that we get a couple trucks a night. And so I think they're coming in anxious to see what we got coming in. But, you know, there's only 4 or 5 items or categories that are really hard. Everything else is coming in, and I don't think anybody needs to panic.
Well, grocery stores are on the front lines of this outbreak. So there are national news reports this week that some grocery stores now installing plastic shields at checkout lines to separate the customers from the cashiers. Are they coming to your stores in Kansas City, Aaron?
They are. We're actually installing those across all of our locations at the moment. It's certainly an undertaking. We're learning every day as we go on. We're adapting to new ideas that come from other retailers, as well as thankfully a lot of folks within our organization are coming up with great ideas, and at the same time following CDC guidelines. And so this is one of the things that came up along the way, and so we're implementing as quickly as possible to protect really both the cashier that's there as well as the customer. So.
I was also surprised to see the story about you not being allowed to bring in many stores around the country now these reusable bags, that grocery stores are requiring you to take their paper or plastic bags. Is that because of bacteria, or why is that?
It is. We're trying to reduce any possibility of transfer of the virus as our most other retailers at the moment. So anything that we can do, any little step that we can take to make it safer and make the customers feel safer, as well as obviously our employees feel safer, they're our #1 asset. So.
You know, we get a lot of questions from our viewers, and we've been asking them because we knew you were coming on. And we have KCPT viewer Fred, who says many shoppers are not practicing social distancing in grocery stores. They need to add more signage to remind people to stay 6 feet away from each other. What do you do about that?
Well, I think, you know, hopefully, you know, the customers will, you know, honor us for that. We're trying to keep people 6 feet apart, but, you know, it's a grocery store. So I think that's just customers are becoming more aware. Signage is going up. We're doing more things like putting marks on the floors. But it's one of those issues to where it's a grocery store. There's a lot of things, and we just need to ask our customers to try to stay away, you know, keep that distance, and we're doing everything we can to keep our employees safe and our customers safe. We're following all the CDC guidelines, and you know, we feel very confident that we're doing everything that we can to make sure everybody's comfortable in our stores.
Is there any other items, by the way, that have surprised you that are not available in the stores?
You know, I think obviously the sanitizers, which doesn't surprise me, but it's one of those items to where I think the Perels of the world and the bigger companies are focusing on the hospitals, which is the right thing. So we've actually kind of reached out to some some local companies to make some sanitizer, hand sanitizer for us, and I think you're going to see that back in our store. So we're doing things like that to take care of some of the needs of the things that we can't get today. But again, I think time is going to be the biggest cure for all of our needs in paper and eggs and flour. But mostly those items that we mentioned earlier are the concerns.
Amy in Kansas City reached out to us too. She says, as someone who works at a grocery store, it would be greatly appreciated if people would be kind to us workers. If you were asked to please wait while we stock the TP, don't be rude and start screaming at us. We are possibly risking our lives or our families' lives by working to be able to pay our bills. The most you can do is be nice. What kind of abuse are your workers taking from customers, Aaron?
Well, Amy's absolutely correct on the fact that we certainly would appreciate the kindness to the employees. They are certainly in a stressful environment right now, but what we've witnessed is really just overwhelmingly positive and just genuinely nice.
So you're not seeing
treatment from the
fights
community.
breaking out in the aisles between people wanting to grab that last roll of toilet paper?
We are not. There's certainly panic out in the community, and we've not really witnessed that within our stores. I think the community has treated our employees with genuine respect, and I think in a unfortunate series of events, this has actually drawn the community together in some ways, and so we've seen just small acts of kindness amongst the customers, and certainly our employees are great every day. So
we also heard from Kim this week, who is concerned about those senior hours that you've now started also, in which you are allowed to have the seniors, you mentioned it a little bit earlier, they can come in earlier. And so, well, the other people are coming in and going, they're not seniors. So I'm assuming you don't have police there at the store looking at people's IDs to see if they're seniors or not.
No, we're just asking our customers to, honor our ask and take care of our seniors, and those are that are more health critical. And I think it's happening in some ways, but I think people are also interested in that new truck that came in. But we're really trying to ask our customers to do that. Impossible to police because we don't know everybody's health conditions, but we really, really are reaching out to our customers and just asking them to honor that 7 to 8. And I think for some stores that's happening. And I think as time goes on and we get more products back in, people will be more confident about the grocery stores, and I think you'll see some more.
All grocery stores, it seems right now, are hiring. They're desperate for workers. Are there some workers you have right now who are fearful to come to work because they're concerned about the safety of food being around customers?
Certainly. I mean, obviously, again, like we said, there's panic out in the community. People are stressed, and so what we've done to combat that is we've allowed a very, very relaxed attendance policy, and we're letting those folks that want the time off to take that time off, and we certainly don't want them to be there if they're fearful of any of this. So that's one of the things that we're doing to try and help them with that. So at this point, if they don't want to be in that environment, we're allowing that.
You know, we see some grocery stores now who are putting their donuts and items like that in rolls behind the counter, and you have to ask for them. Yet all the fruit is still there, and you can still pick those up. Is there concerns about food safety?
No, I mean, I absolutely not. We went all full service. There's no self-service anymore. We have closed our salad bars, and we are full service on our hot bars. So yeah, everything's either in a package or is full service.
Now, we heard about the ugliness that happens where you see people rushing to get into stores to hoard products. Though I do see, by the way, you started at my local Price Chopper, it was a limit of 4. Now I see you put up signs to say limit of 1. That's to prevent hoarding, I'm assuming.
Yeah, I think we're just asking again that everybody honor and let everybody share together. I think that's what we're asking. We got, I think, a limit 2 on eggs, but hopefully we can change that soon, as supply comes in. But we're just asking everybody to share at this point.
We like to, on this program, to use the motto, going from helpless to helpful. What positive story have you encountered in your stores over the past week or so, Aaron, that shows that our humanity is actually going in the right direction?
It's been overwhelming, really. I can't really pinpoint one because there's been so many. We just the other day we received a document from our social media folks that kind of just reiterate to us how many positive comments we've received from the community within the last week or so, and it's just been overwhelmingly positive. So while there's not one in particular, we're just, it looks like every day when we go out to the stores, we see positive things. We see employees and customers helping one another more so than ever before. So very, very encouraging to be out there.
How about for you, John?
Well, exactly. I think that the biggest positive that I can say is our employees have been amazing. I think we have the best team in the industry. I can't tell you how proud I am of every one of them being out there and helping not only do their job, but just be part of the community. And I think our customers have been absolutely amazing. They've understood when we were out of something, they get it. And I think everybody's, things have calming down. I think everybody's going to really get a little calmer and see that everything's going to be fine as far as the food industry goes. And I think.
So you're saying you have great workers, you have got great customers
Yes.
there. So what is the biggest challenge, the thing that keeps you up at night and gives you a sleepless
You
night
know,
at this point?
I have a sleepless night every night, I think. You know what, I just, more than anything, I think my concerns are what everybody else's concerns are. We've never been through something like this, so there's no book written on what we do. I think we just work hard, and I want to say that every Price Chopper family, the Cosentinos and all the other families, we're doing everything that we can day to day to make sure that our customers are safe, our employees are safe, and that and that we're offering all the food needs that we need to offer to make everybody feel safe.
From Cosentino's Foods, with 30 grocery stores on both sides of state line, Joe Cosentino and Aaron Grehan, thank you so much for being with us on Week in Review. And that is our Week in Review. As long as I'm able, we'll be continuing to be here for you during this half hour on KCPT. The show will continue to evolve as we go through this together, but we are keeping calm and carrying on. I'm Nick Haynes. From all of us here at KCPT, thanks for spending part of your weekend with us.